Welcome back guys. Now let's continue with the topic of compliance and elastance. What exactly is compliance and elastance means? See, most of the students, they don't understand the difference between compliance and elastance. Okay, let me tell you. Imagine there is a rubber band in my hand. Okay, rubber band in my hand. Most of the students, what they will say? They will say, sir, when I am stretching a rubber band, they will say, sir, this is elastic property. No, when I am stretching something, okay, if a substance is getting easily stretched, that property is called as a compliance. Okay, or imagine a bubble gum. Say I am taking a bubble gum and I am stretching it. Is it stretching or not? Yes. If a substance stretches easily, if a substance undergo volume change easily with less pressure, so that substance is called as compliant. The substance which will not undergo any volume change is called as elastic. Now see, rubber bands, why they are called as elastic? Because even though I am trying to deform its shape, even though I am trying to change its shape, it is coming back to original position. At the end of the day, it will come back to original position. So that's why it is called as elastic. It is trying to maintain the shape. So for example, look at this pencil. I am trying to stretch it. Is it stretching? No, it's not stretching. So this is less compliant. It is maintaining its shape. So in physiology, this is elastic. Okay. So the substance which will not undergo any volume change is elastic. This is elastic. Okay. But a bubble gum, it will easily undergo shape change with very less pressure. So that is called as compliant. The one which distance easily, the one which changes shape easily with less pressure is called as a compliant, and the one which maintains its shape, undergoing elastic recoil, maintaining its shape, is called as elastic property. Okay. So now imagine your phone. Tell me, I will ask you some examples. You tell me, your phone, your mobile, is it compliant or elastic? Highly elastic. It's not undergoing any shape change. Okay. Bubble gum, compliant. Okay. So let's say a bangle, elastic. This gold ring, elastic. So what I am trying to say, both are opposite to each other. See here guys, what does it mean by compliance? I have explained you. Compliance means is the stretchability of a substance or distension capacity of a substance. What is the formula for the compliance? The formula for the compliance is delta V by delta P. What is delta V by delta P? How much volume is changing? See how much volume is changing and how much pressure is changing. For a given pressure, how much volume is changing will tell you the compliance of that particular substance. Means how much pressure you have used and how much volume has changed. Okay, for a unit pressure, how much volume is changing will tell you the compliance. See for example, in this condition, I am using more pressure. Let's say I am using more pressure, but any volume is changing? No volume. So this is less compliant. Okay, for a given pressure, if more volume is changing, that is more compliant. So how much pressure you gave, how much volume has changed will tell you the compliance property of a substance. Now, have I taught you that compliance is exactly opposite to elastance? Okay. So the one which is highly elastic, see for example this pencil, this is highly elastic. So this is less compliant. Okay. The one which is highly elastic will be automatically less compliant. Same, no? So both are opposite to each other, both are inversely proportional to each other. How this is going to be coming in your exams? Let's take two conditions. One is emphysema. Let's say the person is suffering with emphysema, a person who is a smoker or the child who is suffering with alpha-1 antitrypsin deficiency. We know it will cause a COPD condition called as emphysema. Okay. Now in emphysema, what is the problem? There is damage to a protein called as elastin. Okay, there is a damage to a protein called as elastin because of the excessive protease activity. In emphysema, there is excessive elastase activity, so that the elastin protein is getting damaged. So I have taught you, your lungs are made up of elastin. Elastin is responsible for the elastic recoil, elasticity. So now tell me today what happened? Elastin gone. Elastic recoil property gone. So what will happen to the compliance? You can easily stretch the lung now. Because the elastic recoil decreases, elastin protein gone. So now it is easy to stretch the lung. With little pressure change, with little intrapleural pressure change, you can stretch the lung more wider, more volume change you can bring. So in emphysema, the compliance of the lung increases because the elasticity decreases, elastic recoil decreases because elastin gone. In the same way, what happens in pulmonary fibrosis? Let's say here is your alveolus. Wait, here is your alveolus, let's say. The name itself is there, pulmonary. fibrosis. Your alveoli, because of some reason, your alveoli are getting fibrotic, more and more collagen fiber deposition, more and more elastin fiber deposition. The alveoli are getting fibrotic, stiff. Now tell me, do you think it is easy to stretch this alveolus? No, it is very hard now. Now it's a stiff lung, it's a fibrotic lung, it is very hard to stretch. So what will happen to the compliance? Compliance decreases. Now you can't stretch it, so I am saying the compliance will be less. So fibrotic lungs, stiff lungs are hard to stretch, so less compliant. But emphysematous lungs are easy to stretch. That's why in your pathology you will study in emphysema, in a patient with emphysema, there is large, big lungs, voluminous lungs, because now it's easy to stretch them. Okay. So now what is the normal compliance of the lungs? The normal compliance of the lungs is for every 1 centimeter of water pressure change, for every 1 centimeter of pressure change, your lungs will stretch by 200 ml. So tell me, what is the normal compliance value of the lungs? The normal compliance value for every 1 centimeter of water pressure, your lungs will expand by 200 ml. Okay. Now let me tell you how question is going to come up in your exam. They will say there is a patient. Okay. Look at here. Here is a patient. In this person, the intrapleural pressure change, let's say IPP, is from -4 centimeter of water. I am talking about the water now, not mmHg, in water. From -4 centimeter of water, it is changing to -8 centimeter of water pressure during inspiration. See, during inspiration, this is all happening during inspiration. You know, during inspiration in normal person, the intrapleural pressure will change from -2.5 to -6 mmHg. Now here I am talking in the centimeter of water. So what is happening during the inspiration? The intrapleural pressure is changing from -4 to -8 value. Okay. And how much air he has taken in during inspiration, how much volume change occurred, how much air goes into the lung? Tidal volume in this person, let's say, is 500 ml. 500 ml volume change. Okay, 500 ml expansion. Lungs expanded by 500 ml because 500 ml air goes in. Now what is the compliance of this patient's lung? What is the compliance? So now tell me how to calculate the compliance in this person. Whenever you see the word compliance, the immediate formula that should strike your mind is delta V by delta P. Delta V by delta P. What is the volume change in this condition? 500 ml volume change occurred during inspiration. And how much pressure change? 4 units pressure change from -4 to -5, -6, -7, -8. 4 units of pressure change. Now tell me, 500 divided by 4, how much? 125 ml volume change for every 1 centimeter of water pressure. For every 1 centimeter of water pressure, how much volume change occurred? 125 ml. So compliance decreases. In a normal person, the volume change will be 200 ml. I have taught you here. In a normal person, there should be 200 ml volume change. But in this condition, tell me what happened to the compliance property of his lungs? The compliance property of his lungs is less. For every 1 centimeter of water pressure, how much volume change is happening? Only 125 ml is happening. Maybe this person is suffering with pulmonary fibrosis, less compliant lungs. I have told you, in a person with pulmonary fibrosis, the compliance property will be less. Lungs are not stretching easily. Okay. So this is how the question will come. Always remember the formula for the compliance is delta V by delta P. Okay. Next, what is elasticity? Have I already explained you about elasticity? Elasticity means elastic recoil, the ability to maintain the shape of a substance, ability to resist deformation. Means I am trying to deform it. See, I am trying to deform it, but is it getting deformed? No, it is maintaining its shape. So that property is called as elasticity or elastic recoil, you can say. Okay. See, maintaining original shape or going back to original shape. Okay. Elastic recoil. Now, two important questions. What causes the recoiling of the lung? Recoiling of the lung or the collapsing of the lung. See, in lungs, there are two collapsing forces, two recoiling forces. What are they? Have I taught you? Because of air-water interference, wherever air molecules meeting with the water molecules, wherever air-water interference will be there, there will be surface tension. Surface tension. Now, this surface tension is the one responsible for the collapse or recoil or elastic property. So, one collapsing force is surface tension. You know, it is going to cause the collapse of the lung. Okay. It's going to cause the recoiling of the lung or collapsing of the lung. Next, what are any other forces are there to cause this collapse? Next one is elasticity. Okay, because of elastin fibers and collagen fibers. Okay, because of elastin fibers and call for collagen. Okay, elastin collagen. Your lungs are made up of elastin collagen. What they will do? They will cause this elastic recoil. So this is causing elasticity. This elasticity also causes recoiling of the lung or collapse of the lungs. So always remember, in your lungs, how many collapsing forces are there? 2 collapsing forces. One is because of the elasticity and other is because of the surface tension. Both are collapsing forces. Both are trying to cause the elastic recoil, okay, or collapse of the lung. Now, with this concept in mind, now try to answer this. What happens to the compliance property? Okay, spelling mistake is there, but anyway, this is compliance. What happened to the compliance property of the lungs which are filled with saline? Let's say there is a dead person. During autopsy, you have removed the lungs. Okay, what you have removed? You have removed the lungs. Now, in these lungs, patient's lungs, you have filled with the saline. So, now these are saline filled lungs. Now, tell me, what do you think will happen to the compliance of the saline filled lungs? These are saline filled lungs, completely, it's full of saline. The lungs are filled with saline, or you can say water. Now, these saline filled lungs or water filled lungs, will they be more compliant or will they be less compliant? Are they easy to stretch or are they hard to stretch? Tell me. Usually students will think, sir, saline filled lungs, now there is more water here, it's going to stretch the lungs. No, that's not the concept. Here the concept is, tell me, here in the lungs, no, there is no more air. First, right, there is no air. Okay, now without air, tell me, surface tension possible? It's the air-water interference which is going to cause the surface tension. But here in this condition, it's full of air, it's full of water. There is no more air-water interference, it's just water everywhere. So, there is no concept of no surface tension. Okay, there is no surface tension at all. Now, without surface tension, so now tell me, what happened to the collapsing force? There is decrease collapsing or decrease recoil. Okay, decrease recoiling force, decrease collapsing force. So now tell me, whenever this elastic recoil or whenever this collapsing force decreases, whenever this recoiling force decreases, okay, whenever this inward force decreases, what will be the compliance? Now it is easy to stretch because now the lungs are not going to collapse. That inward collapsing is less, no. So it is easy to stretch. So what will happen to the compliance? Compliance property will be more. Now it is easy to stretch the lung. So saline filled lungs are always easy to stretch. The compliance will be more because there is a less collapsing force, less surface tension. Okay, so compliance will be more. So that's it. So always remember, in a patient or in a person whose lungs are filled with saline, the compliance of these lungs, okay, the compliance of these saline filled lungs will be always more. So from this, can I derive a formula? The formula previously I have told you one thing. Compliance is always inversely proportional to elastance. Both are opposite. But now I am telling you, see, compliance is inversely proportional to surface tension. Just now what happened? In this condition, whenever surface tension decreases, see, no surface tension means more compliance. So write, whenever your surface tension forces in the lung decrease, the lungs will become more compliant, easily stretchable with less pressure. You can stretch them easily. So this is the new formula. Okay, very important. We'll be discussing about this formula in the next video mainly. Okay, next up, what else you have to know? How questions will come in your exam? See, the question is going to be something like this. What happens to surface tension and compliance? What happens to surface tension forces and compliance of lungs in preterm child? Okay, in a preterm child. So in a preterm child, what will happen to the value of the compliance and what will happen to the value of the surface tension of the lungs in a preterm child? You tell me. Preterm means let's say the baby is taking birth by somewhere around 30 weeks of period of gestation. So we all know in preterm child there is no surfactant, enough amount of surfactant is not there. So here there is surfactant deficiency. Surfactant deficiency is there. So now tell me, surfactant is not there means what will happen to the surface tension force? Now the surface tension force is going to be more. Now there is going to be more surface tension. Let me write, whenever the surfactant is not available, what will happen to the surface tension? Now more surface tension. So according to our formula, whenever surface tension increases, what should happen to the compliance? The compliance should be less. Now the compliance will become less. So now you understand how the questions will come. So always in a preterm lungs, okay, the preterm lungs, they are having more amount of surface tension, so the lungs will try to collapse. So the compliance of the lungs will be less. So always preterm lungs are less compliant because there is more surface tension. Why more surface tension? Because surfactant is not there. Okay. So, this is how questions are going to show up in your exam. So, with this what we have completed? We have completed the topic of compliance and elastance. Now, in the next video, we will be discussing about the pressure volume loops. Okay. Hope the video is helpful. Thank you.